Hi, everyone. I'm excited to welcome you to this discussion of Farm to Black Tables, a new policy initiative to help prevent obesity for Black women in the South. Okay, so obesity, which is defined in adults as anyone who has a body mass index or BMI of 30 or higher, is actually a critical major public health concern. Today, more than 90 million Americans are obese, which equates to a staggering 42% prevalence. Additionally, there's over $170 billion in medical costs incurred through obesity-related care every year. Alongside this, we know obesity has major significant impacts on public health. While it might not be directly associated with mortality, it is associated with a higher risk of life-threatening disabling diseases and disability. Those include type 2 diabetes, some cancers, high blood pressure, kidney disease, and more. Additionally, obesity has been associated with an overall lower quality of life and many mental health challenges. Another thing to note is that obesity does not affect everybody equally. There are glaring health disparities associated with this condition. Namely, Black women are 50% more likely to be obese than white women. It's also important to keep in mind that this is a nationwide problem. 31 states have a Black obesity prevalence of 35% or higher, whereas only 8 states have a Hispanic obesity prevalence of 35% or higher, and only 1 state has a white obesity prevalence of 35% or higher. Despite the fact that all of America should be concerned about this, there is one region that is particularly problematic, and that is the South. In the South, 7 of the 10 states with the highest obesity prevalence rates are located in this region. And so that includes states like Alabama, Mississippi, Louisiana, and more. Okay, so what can we do about this? Well, when there's a health disparity, we know that it means that a particular subpopulation is at a social disadvantage. And so rather just noting that that subpopulation might be a risk factor for a condition, it's necessary to create a root cause model that really delves into the reasons that that subpopulation is at that social disadvantage and why they're being affected more. And so in terms of obesity in Black women living in the South, there are a number of root causes that we can pinpoint. There's racism and discrimination, a poor built environment, class, and even cultural preferences like food and body shape. These all influence a number of known modifiable risk factors associated with things like obesity incidence and increased morbidity from chronic disease. Those are things like physical inactivity, stress, poor diet, and lack of access to healthy food. So any policy or intervention created needs to address these root causes first before addressing the modifiable risk factors that are related to outcomes. And that's where I have the pleasure of talking to you about Farm to Black Tables. This is a particular policy amendment to the existing federally created Farmers Market Promotion Program, which has been in existence since 2002. And it's going to actually address the root cause of built environment. And so let's back the truck up and talk a little bit more about what this is. So the FMPP, like I said, is established in 2002, and it's gone through a number of different iterations. But as a whole, what it does is it provides grants and loans to establish farmers markets in communities. And alongside just grants and loans, it also provides technical assistance to farmers markets in accepting a wider variety of payments, particularly low income payments like SNAP and WIC payments. And so that means that it can make farmers markets more acceptable to populations that often need them most. And so what the Farm to Black Tables initiative does is it actually takes this one step further. And rather than just providing funding and assistance to all populations, it actually earmarks funding for state-based programs that look to specifically support census tracts that are 50% or more Black or African American. And so rather than actually distributing this money equally or this assistance equally, it looks at actually saving a certain proportion of this for the people who need it most, in this case, Black women in the South. And so with that money, it gives the states basically mandates to create their own fully staffed farm to black tables programs. And then each of those programs is responsible basically for creating more farmers markets in Black communities in particular, thereby helping people in those communities have more access to healthy food, to eat more fruits and vegetables, and to feel connected to their community. And all of those risk factors targets have been associated with farmers, positively associated with the presence of farmers markets by much evidence-based experimentation. Okay, so this is a great idea for a program, but obviously we need to know that it's going to be successful. And so what we're going to do is implement process evaluation from the get-go. And then if that's successful in the future, we can implement impact and outcome evaluation. But to start with, we just want to make sure that this policy initiative is actually being implemented with the intention that we set out to have. And so we're going to track the number of states that establish a fully staffed farm to black tables program, as well as the percentage of earmarked farm to black tables funds that are effectively spent. Similarly, we're going to have those state-based programs report back on the number of applications from local participants for funding and assistance, as well as the number of new farmers markets established in eligible census tracts, and the number of new farmers markets that accept SNAP and WIC payments in eligible census tracts. And then we're going to compare that with the past. And so all of these measurements will give us some indication that the program is working and that money is being spent accordingly. So just like there are a lot of opportunities that are created by programs like this, it's also important to note limitations and areas of future research. And so one obvious limitation that is often the case with all farmers markets is that they only tend to occur on specific times during specific days of the weeks. And there may actually even be particular seasons where they're not in existence based on crop availability. So this creates their own issues of access and utilization. And so future research should be done to actually look at utilization rates and to understand barriers to utilization and to see how we can improve those going forward. Additionally, community readiness is another big factor to keep in mind. Certain census tracts or certain communities may not be prepared to actually even file an application for this kind of assistance. And those that do may not actually have the resources or the preparation to sustain a farmer's market. So it's really important going forward to actually figure out how the application process can understand and identify these communities and provide the support necessary to make sure they're still getting assistance. So that is a quick overview of the Farm to Black Tables program. Thank you for your support and your time. And we hope that you feel as passionately as we do about the Farm to Black Tables program. And here are a few references. Thank you very much.